Hi, welcome to the Glowing Skin series. I'm Christine Ho, and today I have Dr. Will Cole. He works around the world as a functional medicine doctor. So, hello, welcome, and thank you for being here.
Thanks for having me.
Oh, yes, of course. It's such a pleasure to have you here as well. So, please tell us your own personal story.
My professionally, just for people that don't know, my doctorate is from Southern California University of Health Sciences in Los Angeles, and my postdoctorate education and training is in functional medicine and clinical nutrition. I'm a functional medicine practitioner. I see patients around the world via our virtual functional medicine practice, and the people I have a heart and passion for are people with autoimmune inflammation issues, people with gut issues, people with brain issues, people with hormonal problems. So this is what I live and breathe, is really kind of digging to the root cause of why people are going through these issues, finding out what works for their body and what doesn't, what's serving them and what's sabotaging them, to really deal with these issues so they can move on with their life and live a vibrant, healthy, long life.
Oh, yes, of course. That is such amazing work that you are doing as well. So, please tell us, how did you get into functional medicine?
Well, it started long ago. It started in, I was at school. I was sort of this integrative health school in Southern California. There's MDs and DCs and LACs and nurse practitioners, all kind of there in Southern California learning about how to help people. And I heard of a guy called Karazian who had gone to my school, was older than I was, and was talking about this thing called functional medicine. This was a long time ago. And before, it was more mainstream, I think, than it definitely was not mainstream at all back then. And I kind of started really immersing myself in the research and applying functional medicine principles, which is really just evidence-based alternative medicine. So it's using the best of Western medicine, which is research and the scientific literature, and then the best of alternative healthcare, which is actually getting somebody healthy and not just covering it up with medications and pharmaceutical drugs. So, and I think really functional medicine does that very well. And over the past 11, 12 years or so, we've seen things have really grown to the point of the Cleveland Clinic now having a functional medicine center. There are functional medicine doctors around the world now. The Institute for Functional Medicine, IFM, is doing amazing things. So it's a really cool place to be at. I think we're in the forefront, the cutting edge of healthcare. And now with how we're talking now is how I talk to most of my patients, and we're getting personalized functional medicine support throughout, in people in remote areas, people in the middle of nowhere, and people in big cities that just want somebody that understands why they're going through what they're going through. So I love being, I'm humbled by the blessing that we have to really make a positive impact in people's lives.
Oh, yes, of course. And that is something that is truly remarkable and amazing with functional medicine. So can you also explain a little bit more detail of how functional medicine differs from mainstream medicine?
Yeah, so we're talking about functional medicine. Maybe it's a good place to start. Functional medicine, another word for that's integrative medicine. If I had to kind of boil it down to the big differences between functional medicine and mainstream medicine, number one, in functional medicine, we interpret labs using a thinner reference range. So anybody knows when they go to their conventional like PCP or GP or endocrinologist, whatever specialist they go to, they'll have their lab, and then they'll have, their number for their test, and then they'll have this reference range. That reference range is, in most cases, based on a statistical bell curve average of the population of that specific lab. And if you go to another lab location, you'll see that reference range, that normal X to Y reference range, will vary from lab to lab. So who are people that typically go to labs? Are people with health problems. So a person may go to their doctor, hey, I have these symptoms, I don't feel well, I know something's not right in my body, and they get these basic labs done, and the labs largely or entirely come back quote unquote normal, even though they know instinctively, heck, I don't feel normal. and they're told, you're just depressed, here's an antidepressant, or you're just getting older, or you just need to eat less, you need to work out more, all these sort of well-intentioned reasons, or they're sent to another specialist with more labs and nothing to show for it. I mean, what they're unintentionally saying is you're a lot like the other sick people that make up the population of that lab. If you're going through symptoms or health problems despite normal labs. So we're not comparing, in functional medicine, we are not comparing the person's labs to a population of people who go to labs. That's not a good barometer for feeling great and being great. It is a barometer for comparing you to people with health problems, which is not going to help anybody in the long term when it comes to optimal wellness. So if you take people with health problems out of that reference range, what's left is typically a tighter range of numbers within the larger reference range of where the human body is thriving. They are at optimal health, their body is functioning the best. That's the functional range, hence where we get our name, functional medicine. The second thing we do differently in functional medicine is that we run more comprehensive labs. So we're looking at the health history of the patient comprehensively. So we ask a lot of questions, and that health history kind of says, okay, what labs are most relevant to the individual? We don't want to be excessive with labs, but we still want to be comprehensive. And so looking at things like microbiome issues or hormonal dysfunctions or food sensitivities or nutrient deficiencies or toxicity issues, whatever is relevant to the case, we're looking at these underlying pieces to the puzzle that give rise to the symptoms and the ICD-10, the diagnosis codes of why somebody is going through what they're going through. And then the third thing we do differently in functional medicine is we realize we're all created differently. There's not a cookie cutter, one size fits all approach to health problems. I've seen healthy, good things work for one person, and then those same good, healthy things flare the next person up. I try not to have a bias as, this is the way that everybody with syndrome, B should live their life, because I'll be proven wrong with the next patient with syndrome B. So I have to look beyond the superficial layers of things and say, okay, what are the underlying facets? So look at their health history comprehensively, look at their labs comprehensively, and then use real life as a lab and what works in their life and what doesn't. So we use food as medicine based on the labs in the case. We use herbal botanical medicines based on the labs and based on the patient's health history. And we look at lifestyle, non-natural medicine, non-food stuff. It's like stress management and sleep and physical activity and the mind-body component and medications when needed to really be holistic and comprehensive, but based on the labs. And then we see those labs improve from an objective standpoint over time. And then obviously subjectively as the patient feels better. That's another way we gauge improvement as well. So that's my long-winded sermon on functional medicine.
Oh, yes, no, that's actually great that you can give that explanation for so many people to try to understand more about how functional medicine can differ, especially from mainstream Western medicine. And so I take it that it's actually those three things that you help describe about the differences between functional medicine and mainstream medicine, which is actually how you are able to find so many different underlying problems that mainstream medicine can very easily overlook.
Yeah. Well, yeah, I think there's a place for mainstream medicine, right? They are trained to diagnose a disease and match it with a medication. And there are people that are alive because of medications. There's people that their lives have improved because of medication. So I'm not demonizing mainstream medicine. There's a place for it, but it should know its place. And we should also know where its place is not. Because what happens when the patient's completely compliant? What happens when they've been a great patient, they've done all the medications they were told to take, they do everything their doctor tells them to do, and they're still having problems? That's when you have to know, okay, you have to do something different to see different results. I mean, I'm saying, yes, of course, do everything that your doctor's telling you to do, but if it's not working for you, if it's not improving you, if you're just sent to another specialist with a pile of labs and nothing to show for it, there has to be something. I mean, what's the definition of an insanity? It's doing the same thing repeatedly and expecting a different result. So that's really what we do in functional medicine, is what's missing from someone's health puzzle.
Okay, so you would more say that a person should go to a functional medicine doctor only after they find that mainstream medicine doesn't seem to work for them.
I would say that's how it happens most times. Now, there are some people that know, they've done their research and they know what options they have in mainstream medicine, and they don't want that option. So I love informed patients. I love empowered patients. And Dr. Google, as we're talking through the internet right now, it's a double-edged sword. It's a lot of information, right? So some patients may be well informed and they know, I don't even really want that. Or they have a family member that has gone through it and they know, I don't even want that. I would just say more oftentimes than not, most of my patients have done everything under the sun before they get to me. But I would love a patient that says, okay, I don't even want to be put on that steroid or that pharmaceutical drug. I really want to just go a different route. And there are some cases where that's completely relevant too, where mainstream medicine really doesn't have even a good option for them based on their health problem. So yeah, it's on a case-by-case basis though.
Of course, and that makes a lot more sense, especially because of how different and unique each and every individual person is.
Yeah, absolutely.
Of course. So please explain to us and the audience about how much functional medicine relates to skincare.
So our skin is really a reflection of what's going on in our body. So it's not compartmentalized in functional medicine. It's not compartmentalized in just physiology. Remove functional medicine from it. It doesn't have, skin problems don't happen in a vacuum. There is a reason why someone is going through what they're going through. And there's many, many possible reasons. So I don't want to hang my hat on one thing. It's a multifaceted, different ripple effect that can happen in the body. But I'll talk about some things that I see often for skin problems. And that is, number one, your gut. You have what's called the gut-skin axis and the impact that our microbiome, our gastrointestinal system has on our skin. So many skin problems, almost every skin problem you can think of, from acne to rosacea to dermatitis to skin flares in general, they are, research has connected them and associated them with these underlying disturbances of the microbiome. The microbiome is the term for the trillions of bacteria in our gut. Micro, small, biome, life. Is small life, upwards of 100 trillion bacteria, even though some studies show a little bit less than that. So let's just say upwards of 100 trillion bacteria. We have about 10 trillion human cells. So that makes us 10 times more bacteria than human. A sort of, sophisticated host for the trillions of microbes, these colony-forming units of this microbiome metropolis in our gut and on our skin. And in our mouth as well. So the impact that our microbiome can have in the gut, our gut microbiome can have in our skin, different imbalances or dysbioses in the gut has been associated with skin flares. Yeast and fungal overgrowths like Candida or Candida overgrowth are linked to skin issues. Different pathogenic overgrowths can definitely be are associated with skin issues as well. And leaky gut syndrome or intestinal permeability. So things are passing through the gut that shouldn't be able to pass through the gut. And this can create systemic inflammation in the body. And this dysfunction of intestinal permeability or leaky gut syndrome, as it were, is also associated with leaky gut, associated with skin issues, inflammatory skin issues. And this whole field of skincare and a lot of these skin issues are linked to pro-inflammatory cascades in the body. And the root of inflammation, in many cases, are underlying gut issues. So there's the gut-skin axis. And then, as I mentioned, you have a skin microbiome as well. And that a disruption of your skin microbiome, or the bacteria on our skin, can also be a facet of skin problems as well. A lot of the products that people use really disrupt the skin microbiome and don't encourage healthy bacterial diversity on the skin. So we're dealing with both upstream and downstream issues, or different sides of this sort of complicated pathway of skin health. So we're looking at the skin itself, but also we're looking at underlying gut issues, and then you really can't talk about skin health without talking about hormones. So looking at testosterone levels and fluctuations of that are also linked to skin issues. Estrogen dominance is linked to skin issues. Looking at progesterone levels, and then looking at thyroid levels and cortisol levels. So all of this stuff. It's not one thing. We can't be myopic and say it's just that. Well, it's typically a ripple effect. Your body's interconnected. So if one thing's off, it can impact dysfunctions and dysregulations in other parts of the body as well. But these are some of the issues that we look at when it comes to skin health. And then if I could mention one more thing, and then I won't quit. I will quit rambling. But is vitamin deficiencies, which can have something to do with the gut and the absorption of certain nutrients, but looking at vitamin D, looking at vitamin A, looking at vitamin C, these are important facets to look at too. And as impact the hormones, impacts the gut, it's kind of all interconnected, but these are the pieces of the puzzle that I would consider from a functional medicine perspective when it comes to skin health.
Oh, yes, of course. That's all incredibly good and very useful information that I'm sure a lot of people will be able to learn from and want to understand more about as well. So what are some things that some of those, people, especially with those skin conditions that are resulting, from the gut skin axis, among all these different other things that you have helped describe, like the hormones and the vitamins and everything else, how do you help them to understand which underlying problem it could be that they can work on for themselves?
Well, there's two different layers, I think, to this. Is that one is that they could learn on their own and implement functional medicine tools on their own. We have a lot of information on our website at drwillcole.com. I think that if someone's like new to this and maybe like they don't even know where to start, I think that a good functional medicine education site like we have is a good resource because they may want to just start things on their own. We have a lot of free content on the site. You can just kind of learn of what the research shows. I go to great lengths to hyperlink it to the research. You can kind of see, okay, where am I even getting this information? And then we have video classes too if you want to geek out on that kind of stuff. And then for the person that has tried stuff on their own and they're still struggling with these health issues, I think that's when a good qualified functional medicine practitioner comes in. We see patients around the world virtually, so we offer a free health evaluation if you want to get a functional medicine perspective on your case. And there's other functional medicine doctors around the world as well that are great. So if wants someone locally, I'm based in Pittsburgh, but again, 80% of our patients are seen in other states and countries.
Oh, yes, of course. And I'm sure that is something that a lot of the viewers would love to learn about more as well. And that's always a great thing.
Yeah.
So, yes, of course. So what would you say are all the signs and symptoms that you would recommend someone to come and see a functional medicine doctor for?
Well, normally intuition, especially with brilliant women, I think that they understand there's things going on. They're less likely to put things off and ignore it entirely compared to men. With that said, I think a lot of women put things off due to different reasons. They're typically putting it off because they're taking care of other people and not taking care of themselves as much. They're putting themselves on the back burner. So moms or the caretaker for an aging parent, or they're just busy taking care of their family in general with work. So but at the same time, I would say that most of the time women, even if they're putting it off, they still kind of know this isn't right. I don't feel like myself. This is not, whatever health issue it is, this isn't normal for me. So these things that we're talking about today, whether they're hormonal problems or autoimmune inflammatory issues or gut issues or skin issues or all of the above issues, they are typically chronic degenerative issues over time. They tend to get worse, and it's good to deal with them as soon as you can, right? It's normally progressive with time. Now, so it could be anything really. So anything you're not used to having and you have an instinct that this is not right for your body, I would get it checked out get it checked out and do your due diligence as someone who's going through this. What's going on in my body? Because you cannot depend on anybody else other than yourself to take the action to do something about it. And then, I would say some of the top symptoms I see would be fatigue, like the early signs, I should say. The early signs that I see that people start noticing it in their life started with fatigue and brain fog, digestive issues, even if it's like subtle digestive issues, skin issues are a part of that. And then it becomes more and more inflammatory issues, more and more, it just continues to grow over time. And this could be years and years, decades in the making. For some people, it happens overnight. But it's these chronic inflammation really is the commonality between a lot of these things that we're talking about. And inflammation can manifest in different ways and for different people. So anxiety and depression and brain fog are linked to inflammation. Fatigue is linked to pro-inflammation issues. Skin flares are linked to inflammation issues, gut issues, joint pain, muscle issues. These are all pro-inflammatory in nature, having inflammation component to them. So I would say that any manifestation of inflammation in someone's body is a sign that something's not right. Inflammation is not inherently bad, right? Inflammation is part of our immune system. It's a good thing. It fights off virus and bacteria and heals our body. But that's inflammation imbalance. And what we're talking about when it comes to inflammation, it's hyperinflammation. It's chronic, insidious inflammation. That's the issue. It's imbalance, really. So it's like a forest fire, burning in perpetuity and not calming down and dying off. That's the problem. So anytime there's imbalance of the immune system, we have this hyperinflammation going on for these chronic issues. And that's a sign that somebody needs to start digging into what's going on in their body.
Oh, yes, of course. That makes perfect sense. And definitely a lot of good information that I believe a lot of people can learn and grow from. And so you mentioned that there were many different also skin issues that people come in from the early signs of. So, aside from inflammation, what other types of early skin issues that you see people for?
Well, it could be dry skin, it could be itchy skin, it could be acne, it could be rosacea, it could be dermatitis, it could be eczema, it could be psoriasis. So these are the things that I see most often when it comes to the skin.
Oh, yes, of course. And so what are some things that you do to help those types of people?
Well, we start with labs to find out what's relevant. Because in healthcare, when it comes to functional medicine, just because something looks like a duck doesn't mean it's a duck. We have to find, is it a swan or a goose or a really good duck impersonator? So we have to look under these underlying root issues. So all the things that I mentioned, we have to find out what's your piece of the puzzle and not just say, well, because you have skin problem A, whatever that skin problem is, well, then you should do X, Y, and Z. Well, it may be true, but it may not be. So let's find out for sure, as sure as we can be when it comes to labs, to see, okay, what are these underlying pieces of the puzzle for the individual? So is it healing the gut? Is it supporting hormonal imbalance? Is it looking at nutrient deficiencies? Is it looking at toxins, which is another component? So not everybody has all those problems. So I don't want to, well, statistically, it's likely that they're going to have gut problems. Well, maybe, but within the realm of gut problems, there's a lot of different variables to consider, and not everyone is even needed or advantageous or wanted for everybody. So we have to kind of customize healthcare, and that's really what functional medicine is. It's tailored, personalized, evidence-based alternative healthcare to the individual. So I don't know if that answered your question, but.
No, I think it was definitely very helpful for other people to learn for. And so you mentioned that, because you do so much consulting around the work as a functional medicine doctor around even the world, so some of those people, their lab work might be a little bit more difficult to do. So how do you handle that, and how long would it take for some of them?
Yeah, so obviously there's we're used to shipping out labs to people depending on where they're at. So within the United States, there's different state, logistics to consider, and there's different country logistics to consider. But we're not replacing someone's primary care physician. We're not taking that role. They are still sticking with their PCP. We are just adjunctive, complementary wellness support in functional medicine to deal with these underlying issues, to give them a game plan, to give them support, give them answers and solutions to these health issues. So we just drop ship labs to their house. Most of them, you do them at home. So the stool tests you can do at home, hormonal tests like urine and saliva tests you can do at home, toxin tests you can do through urine and hair, that can be done at home. The blood tests, we just would give the requisition form for the local lab in the person's area, or they send labs over from their PCP, and we integrate all that information. We basically get multiple labs' perspective from their vantage point, what the heck's going on here, and then we can have our report and kind of give them guidance on what they would do with these issues. So it really is, we make a big world small through, consultation via the webcam or the telehealth aspect of things. And we have the amazing shipping network of FedEx and USPS and DHL for international to really get patients' labs wherever they're at.
Oh, yes, of course. I'm sure a lot of people will be very happy to learn more information about that as well, especially if they're not localized in your area.
Yeah. Mm-hmm.
Yes, of course. So you do have an extensive amount of articles on your blog section. So tell us more about those.
So I am a writing nerd, and I write every day I can. And I've been doing it for a long time, and just want to write about things that interest me and what people are interested in. And it's categorized, and you can use the search engine at drwillcole.com to really find out topics that interest you. And I write for mindbodygreen, one of the largest wellness websites in the world. They're amazing. I'm one of their course instructors and wellness experts, so I write on there as well. And yeah, I've written on Goop, which is Gwyneth Paltrow's website as well. So I love this stuff. I could talk about it all day long, as you probably can tell. But yeah, there's a lot of information online.
Oh, yes, of course. And I'm sure that is something that a lot of people would love to dig around and read whenever they have free time.
Yeah.
Yes. So please tell us, what are you most proud of from 2017?
So 2017, this past year, I'm most excited about us reaching more people. I really feel like we're doing amazing things. My team is really hardworking, and we keep our nose to the ground, and we take the responsibility of caring for someone's health journey and being a support system to their health journey very, very seriously. So I love that we keep our nose to the ground. I love that we're staying in our lane and we're doing what we love. And I love that we're making a positive impact in people's lives. And I love that that's growing. Growing in the sense of we're able to reach more people, and growing in the sense of even if they're not our patients, our articles, our video classes are reaching people that just want to bring some of functional medicine into their life. And we in 2017 we're preparing for the amazing things in 2018. We have a lot of things coming this year.
Oh, yes, of course. So please share with us what you're most excited about for 2018.
I'm glad you asked. I am so excited. We have a new video class coming in 2018. Probably in the summer of 2018. And we have my first published book with Penguin Random House, Avery Books. It's a plant-based ketogenic book called Ketotarian. So it's sort of an amalgamation of the plant-based diet and the best of the ketogenic diet to really drive inflammation levels down, to curb food cravings, to boost energy levels, and to really bring vitality to people's lives. So it's called Ketotarian. It's on pre-order now. It'll be out August 28th, 2018. And we also are speaking at some events that are pretty exciting this summer and in the fall time. So I can't talk about those right now, but super exciting events bringing functional medicine to kind of a bigger scale. And yeah, but primarily Monday through Thursday, I'm immersed in patients. So all of this extra stuff happens on the Friday and the weekends. I'm with patients Monday through Thursday, all day, every day, and that's where my primary focus still is.
Oh, yes, of course. You are incredibly hardworking.
Thank you.
Yes, of course. So please share more details and tell us about your free gift.
Yeah, so we have some exciting free gift for everybody that's joining right now. So if you want to learn more about functional medicine, this free gift's going to give so much information. So it's tons of functional medicine information. It's an ebook, so get it free download to Heal Your Gut Guide. It's sort of a functional medicine perspective on gut issues, which is super appropriate because it's what we talked about today and the impact it can have on your hormones and your skin and your brain. And super excited for everybody to read it.
Oh, yes, of course. So if you would also like a copy of this free book, please click on the link below. Thank you so much for being here with us today, Dr. Wilcol.
Thank you so much for having me. I appreciate it.